Hello everybody, my name is Paige Edwards and today I will be giving my presentation on anorexia nervosa. To start off, we look at the making of a disorder. The definition of anorexia nervosa is an eating disorder characterized by the desire to be extremely thin. People suffering from anorexia have an intense fear of gaining weight. They lose weight rapidly by restricting their diet to little or no food intake at all. To break it down even farther, I categorize these into three groups of what make this disorder. First is the mental aspects. A person suffering from anorexia will have low self-esteem, a distorted body image, and a desire to be perfect, also known as a perfectionist. They like to control things in their life, and a person suffering from anorexia chooses to control their diet and exercise. A person may also have suffered a tragedy or an extreme stress, such as an abusive relationship, the loss of a loved one, or even losing a job. The physical symptoms include compulsive exercise combined with extreme dieting to lose weight rapidly, isolation from friends and family. They may stop showing up or talking to anybody, communicating, telling anyone what's going on in their lives because they want to stay in their own little bubble and continue to starve themselves because they are not happy with themselves. They feel ugly and fat and unworthy. But it's not true, it's just all in their mind. The medical complications are life-threatening and lasting. For example, reduced bone density is irreversible, along with the psychological disturbances that can be reversed, but takes a long time to do so. Next, we talk about the warning signs. These are just some of the symptoms and signs a person suffering from anorexia will show. The first one, obviously, is extreme weight loss. Fatigue, fainting, dry, brittle nails, hair loss, intolerance for cold. In women, the absence of menstruation called amenorrhea, the development of fine hair on the arms and legs called lanugo, low blood pressure, development of osteopenia, another bone disorder, and irregular heart rhythms. So what influences anorexia? The social influences can lead to anorexia. One of the peer-reviewed articles I read called Do Friends Share Similar Body Image and Eating Problems by Hutchinson and Rapp talked about the study they did on 173 friendship cliques who took a series of questionnaires. And after gathering all that information, they concluded that peer influence does have a negative effect on adolescent girls in their eating behaviors, the way they view food, the way they view their body, and all of that. So moving on, families do play a role in what can lead to anorexia. If a person has an overbearing father or mother, going back to that state of wanting to be a perfectionist, they want to feel that power back in their lives, so they control their diet. And it makes them feel good when they lose the weight and they get addicted to that feeling. Along with societal standards, we are in the digital age where we're constantly bombarded by pictures of this unobtainable body. But there are two women who are combating that. One is Megan Jane, who did suffer from anorexia, but as you can see her after picture on the right, she is doing so much better now, and she is using what happened to her as a platform to help other women get through having any type of eating disorder. Along with Ashley Graham, who is another body positive activist, she was featured on the cover of Sports Illustrated magazine as the first plus-size model to be featured, which is very rare because usually they just feature thin women, that ideal body that I was talking about. But she is not afraid to challenge those societal views, and neither is Megan Jane. I really look up to these women and follow them on Instagram. That's why I wanted to include them in my presentation. Next, we move on to a case study which I found very interesting. It was about anorexia nervosa and Wernicke-Korsakoff syndrome. Researchers conducted a study about individuals diagnosed with anorexia who also abused alcohol, and they are at a very high risk to develop Wernicke-Korsakoff syndrome, which is basically brain damage due to lack of B1 vitamin. This lack of B1 vitamin causes lasting memory loss. As I read on in the article, it talked about the 45-year-old woman who was admitted to the hospital showing signs of malnutrition and mental confusion. She was diagnosed with anorexia and had also been drinking gin on a daily basis. So the combination of her anorexia and increase in alcohol depleted her of all B1, which led to her memory loss. So as she was drinking more alcohol, her need for thiamine increased. But while she was drinking more alcohol, the thiamine absorption decreased. So she basically put herself in a position to create a double negative in a sense, where she was just depleting herself but needing it, and it caused lasting memory loss because at the end of the article they did a 6 months checkup on her and she still had no idea what had happened, and she continued to show signs of memory loss. So like I said earlier, the effects of anorexia are lasting. After giving you all of this overwhelming and maybe depressing information, there is hope for people who suffer from anorexia. They can get help. The main priority of someone who comes into a hospital is to stabilize the patient after they're suffering from anorexia. They have depleted their body of all nutrients and water, anything like that that your body needs to survive. They have depleted themselves of all of that. So, like I said, main priority is to stabilize the patient back into a good physical condition so that they do not die. This can happen in inpatient and outpatient treatment. Other treatment options are family, group, or individual therapy, whatever the patient feels comfortable with. And what I think is most important is education about nutrition. The person needs to know what happened to their body, what they did to their body, and also how to live a healthier lifestyle so that they can maintain a weight that is healthy but still what they want in their life. So, as we come to successful outcomes, overcoming anorexia is extremely difficult, and the psychological damage has been done and takes a long time to recover from. So this case from the Eating Behaviors Among Women talks about that. They conducted a study to track eating behaviors before and after weight restoration in patients recovering from anorexia. The study monitored 12 girls who were admitted to the hospital for anorexia and 12 girls who were considered a healthy control group. The results concluded that after weight restoration, the 12 girls recovering ate significantly less than the 12 girls in the control group. The best results come from therapy and education, and the road to recovery is long, like I've been saying, but it is obtainable through the help of family and friends. That concludes my presentation. I hope you enjoyed. Here is a list of all my references. Thank you for watching.